will have erectile dysfunction. So I always tell people to be cautious because there's other medications that you can take in place of gabapentin. I know that is not the big focus, but you got to think about it. A young person, young men, that's a quality of life for them. I mean, a lot of people under 60, 65 in our practice, sex is important to them, and so they don't want to be on any medications that actually causes erectile dysfunction. Some of the blood pressure medications also causes, good morning or good afternoon, causes erectile dysfunction. So you want to be careful of that. So make sure that you're checking with your physician, because then next thing you know, you're adding a medication to counteract a symptom. And then next thing you know, you've added 5 or 6 medications. And the goal is to have a quality lifestyle, a quality, healthy lifestyle. And taking sex away from a person actually depresses a lot of men. I have heard a lot of men say that they are depressed because they cannot be sexually active. So that is important for you guys to look at your medication list if you have erectile dysfunction, or to prevent getting erectile dysfunction. Make sure that if you're taking medications, you're taking medications short term. And people say, well, why that's important? It is important to a lot of men. A lot of men say if their penis doesn't work, they don't want to be alive. I've heard that so many times. So I always, stress, yes, it's important. People may not talk about it, but it is important to a lot of men. So it took you 6 months to get off of the insulin. What is your A1C now?
My A1C is at a 7, from 12 to 12.9 to 7 now. So
That
she
is
just
awesome.
she just got me on the med, and she just say let's see how this do. So yeah.
So are
O-
you able to drink alcohol or anything like that?
Occasionally, like I don't just go and do it, when I'm with my partners or anything like that. Nah, it's got to be a special occasion. But and then I don't have too much. If I'm gonna get alcohol, it's probably be maybe one bottle or maybe one shot, and I'm cool.
Right.
Yeah,
Okay.
I don't do it often at all.
Good. Um, okay. I'm sorry. Martell. Go ahead, Martell.
I'm sorry. I want to ask you. My son is a over the road truck driver as well, and he was just diagnosed with diabetes. Um, I want to make sure I told him the right thing. I told him to keep a bottle of orange juice in his truck in the refrigerator in case his sugar gets low. Is that the right thing? Because he doesn't have to. He won't take the glucose tablets. He's real hard headed, and I say he's in denial because he still wants to eat whatever he wants to eat. He's not making a diet change whatsoever. So I worry a lot about him, but I'm wondering if he just keeps orange juice, if it should go low while he's in that truck. Is that the right thing, or is there something else that he can keep on him as he's down up and down the highway?
Yes, and with that orange juice, while he's drinking that orange juice, give him peanut butter crackers. So when the
Okay.
orange juice is going to bring it up quickly, but then he'll drop quickly if he's not doing some type of protein. So if he keeps peanut butter crackers in the vehicle with him, it'll actually help sustain that blood sugar. So yes, that is a
Okay.
good idea. But I would just add or either nuts, because it'll actually help maintain the blood sugar.
Okay. Thank you.
You're welcome, Angela. Are you there, Angela? Someone had a question about how do they get off insulin. You have to work closely with your doctor. You want to make sure that you are monitoring your diet and your exercise. Diet and exercise is huge. After you eat, walking 15 or 20 minutes to actually help bring down your blood sugar. Also, not only walking 15 or 20 minutes, if you have access to a sauna will actually bring down your blood sugar. The goal is to maintain that blood sugar so that you don't have to use insulin. A lot of times they will do a sliding scale with insulin to actually drop the insulin down. So say you start off at 20 units, and after doing something for 2 weeks or 3 weeks, they'll say, okay, we're going to go down to 15 units. So they'll gradually work your way down until you're not taking insulin anymore. And usually they say if your fasting blood sugar is less than 120 after so many days, then they're able to take you off of insulin. So Code, how did you get off of your insulin?
I was terrified. So once I realized what the situation was, I mean, I just stopped. I did a lot of soups, a lot of liquid stuff, no sugar. Like I was really eating directly right. Like I was terrified. And that pushed me to get off insulin because I mean I didn't want to be on dialysis or nothing like that. So I did a complete life change. Like that would actually help me out. You know what I mean? And like she said, her son is kind of he don't believe that the situation is that serious. Now, when I was in that bed and I realized that I was in ICU and had a potential of not leaving that room, yeah, that was a good check. Yeah, it checked me out real quick. So
Yeah, your pictures reminded me so much of Slim's pictures with all the pumps there and all the bags hanging and the heart monitor. And, you guys have no idea. If you've seen a person in ICU and they're confined to the bed, they have a heart monitor, they have multiple tubes, they have all this stuff on them. And it is overwhelming. And for people that care about these people, it's hard to see them like that because they don't really understand what's going on. And that person, which I didn't say this to you, Slim, but that person are in jeopardy. Their life is in jeopardy. It is a serious situation. So when you're in ICU, you only have one nurse to two patients because they require so much care and so much time. They're in there every hour drawing your blood. I mean, you're in critical state, which they could lose you at any time. So it's extremely, extremely important when you guys have loved ones in that situation. And they limit the hours and they limit the family members to ICU because they need the person to rest as much as they possibly can and to actually focus on getting better. But it's a lot to have a person go through that. Mr. Williams, hi, how are you? You're on mute. You can go ahead, Mr. Williams.
he on mute.
Okay, there you go.
Hey, how you doing?
Good, how are you?
I'm doing all right.
Good. Do you have something to share with us?
Yeah, I was listening to Slim. He was talking about the walk. Exercise is very important. Very important. If you can get up and just do something every day, you good. Like you said, eat right. You
Right.
can make it.
Are you a diabetic, Mr. Williams?
No.
Okay. All right. Do you have hypertension or high cholesterol?
No.
Okay. When was the last time you've been to a doctor?
I've been back in 24, but I got an appointment come March.
Okay, good. Okay, good. Thank you. I appreciate that.
Yeah.
Joyce? Hey, Joyce, how are you?
Hi, I'm good. I have been a diabetic, type 2 diabetic, for probably 20, 23 years now. I was not born with it. I became a diabetic after losing my mother, and I ate my way through the grief, which took me up to probably about 400, 450 pounds. Diabetes was out of control for probably 20, 22 years. My A1C at one point was the highest was at 15. I was told by doctors I was lucky to be alive. Within the last 5 months, I have went to see an endocrinologist. They have changed all my insulin. I went from 6 to 7 shots a day down to 2 shots a day.
Oh,
I
good.
have dropped my A1C from the 15 to a 9.6 in I'd probably say about 5 months at the most. Went from 7 to 800 blood sugars daily to 120 and below now to the current time. I have high blood pressure, I have high cholesterol, you name it, I have it. When I say it's all about your mindset, your diet, your exercise, I have arthritis, I have a artificial leg. Sometimes activity can be very limited for me. So I was encouraged even by my
Did you
I
lose your
don't
leg to diabetes?
no, I did not. When I gained so much weight after losing my mother, my bones were not supporting the weight that I was carrying. So I could just be walking down the street and hit the ground. And that's as a large person, that's not helpful on my body at all. But I would say roughly about August or September last year, I got to the point where I was just ready to take myself off everything and say give up on life because I couldn't get my insulin. Insurances weren't covering my insulin. All the insulins the doctor wanted me on were on back order recall because people are using them for the weight loss.
I think
So
you're
when I-
referring to the GLP-1s that they were on
Yes.
recall, the Ozempics and Mounjaros and Zepbounds and Wegovy. Those medications were,
Yes.
people were using those for weight loss, not the insulin.
Well, but it's still classified as an insulin for a diabetic, and I
No,
couldn't get them.
okay, no, it's
The
not.
insulin I take currently is Humulin R500, which is just one of the strongest insulins they make. And I even had problems getting it because they said they don't generally put that out for diabetics unless no other insulin works.
Right. I don't want to misinform anyone. The GLP-1s, the semaglutides and tirzepatides, those are different than insulin. They work different on the body than insulin. So I just don't want anybody to have the misinformation. But those medications, the Wegovy, the Zepbound, the Ozempic, the Mounjaro, those are not insulin. So please don't misunderstand that those are insulins and think you can take those in place of insulin. They are not insulin. Those are used in addition to insulins to actually help control and manage diabetes. Arthur, how are you, Arthur?
Good afternoon, Miss,
Good afternoon.
and good afternoon to everyone. I have a question for you.
Yes.
What different types of insulins are out there? Because just recently I lost my transplant pancreas and kidney. So I'm back on dialysis. I'm also now back on insulin, and I can't seem to get it under control. I do have an appointment coming up in February, late February, to see an endocrinologist.
Oh, good. I was going to suggest that. Okay, so if anybody in here is a diabetic, you need an endocrinologist, and I'll tell you why you need an endocrinologist. The internal med doctors, family doctors, they follow protocol. They follow the American Diabetic Association protocol. That's what they were trying to follow in the hospital with Slim. But it's like, hey, you know
They
what? I
be
work for
fucking that shit up. They fuck up. They didn't know. Poetic was on their ass and had to tell them what to do with their goddamn job.
Yeah, they were. And one person even said, can you rewrite our protocol? When you go to an endocrinologist, it's different. An endocrinologist is going to actually specialize in the endocrine system. They're specializing in diabetes. They know things that the family medicine doctor may not know. You think about family medicine, internal med, they're doing this a general body. But when it comes to specializing in something, you need an endocrinologist. With you, Arthur, having a pancreas transplant, you should have automatically had an endocrinologist on board. And I'm not sure why you didn't. You wanted to know about the different types of insulin. There's short-acting insulin and long-acting insulin. The short-acting insulin is going to go into effect 15 to 20 minutes to up to 2 hours, sometimes 4 hours, depending on what you take. And so that's usually taken with meals. If they check your blood sugar and say you're 200, and they might have a sliding scale. With the sliding scale, they'll say if you're between 150 to 200, take 2 units. Which they gave Slim 2 units. Slim is 6'5" and over 250 pounds. What is 2 units going to do for him? 2 units is like giving him a sip of water when he's extremely thirsty. That does absolutely nothing for someone of his size. However, in a blood sugar of 400, what is 2 units going to do? So Arthur, back to your question. So they put you on sliding scales with the short acting. Lantus, they have long acting insulins. Lantus is one of the long acting insulins. With the long acting, it stays in the system 24 hours. However, endocrinologists dose it every 12 hours. They'll say the first 12 works better than the second 12. it starts to taper off within that last 12 hours. So that's why they dose it twice a day, 9 p.m. and 9 a.m., because it's going to release a small amount of insulin every hour on the hour. But when you get to those later hours, it's not as effective. It starts to lose its effectiveness, especially if the person is eating. If the person is NPO, it's different. NPO is nothing by mouth. It's different. But if they are eating and drinking throughout the day, first 12 hours better than second 12 hours. And it's always better to do the twice a day dosing with long acting insulin. The short acting insulin is usually out of the system within 4 hours. That's why they say you can do it at 7:30, 7 a.m. Then you do it again at lunch and dinner and sometime at bedtime. Some people worry about the bedtime insulin because they think that they're going to crash with short-acting insulin. So I always suggest that you do a snack, some type of protein snack, cottage cheese, string cheese. And I know with triglycerides, it's touchy because they took Slim's cheese away and he had a fit and had a breakdown in the hospital because they took his cheese away. If you have high cholesterol and high triglycerides, you have to be careful with certain foods. Cheese is one of those foods that they want you to be careful with. But Arthur, send me an email, and you do have an endocrinologist on board. I assume your pancreas is not functioning at all anymore, which is, you said it failed?
Yeah, but this was the thing. My transplant team was my endocrinologist because when I lost the kidney, it was due to COVID and then also due to me having colon cancer. So I lost the kidney and everything, and my pancreas was still working. But when my doctor put me on, what is it called? I forget the name of the medicine. My endocrinologist, not my endocrinologist, my cancer doctor, he put me on I forget what it's called, and it caused my pancreas to fail, which we knew it, but now I'm just having a hard time because I do the sliding scale, and I'm really scared of it, but now that I'm a little bit more informed about the long-acting, what you just said, because I understand everything that you be saying most of your lives. Yeah, most of your lives, I really be understanding a whole lot, because I've been dealing with my health since 98, 96, around that time. I've really been dealing with my health. So being in and out of hospitals, listening, that's why I said I understand a lot. But back to my point, now that you explained the long acting, maybe I'll try that approach, because I have a tendency, if I take too much of the long acting, like 6 units, I will bottom out real quick,
Long acting or short acting? Because long acting is released a tiny bit over a period of time. Or so are you referring to the long acting or the short acting?
Well, when I take the long acting, normally I've been kind of running high, like in the 3s and the 4s, and I'm trying to get that under control, because before I got my transplant, I used to manage my sugars really good and everything. My A1Cs would run like 6.
That's excellent.
And stuff.
6 is a great number.
Yeah, before I got the transplant. Then when I got the transplant, that's 8 years later. So now I don't think the human globin, what is it called? Human,
The A1C?
the fast acting.
A1C?
No, I meant to say that the Humalog.
Oh, yeah.
Is that the long acting or the fast
Short
acting?
acting. That's the fast acting.
Okay, the fast acting, yeah. When I take that and I go to sleep, I know when my body drops, and then when it drops, I go into a weird mood, like disorientated a little bit. I'm trying to grab whatever I can grab, but it's good to know, like you said, have some type of protein besides having the tablets or the juices and stuff around me. So, like I said, I'm gonna try your approach with the long acting. Maybe take 3 in the morning, and then 3, maybe 2 at night.
No, those are just suggestions. I would confirm it with my doctor if it's okay for you to do that. So you guys, I'm just giving this for educational purposes only, and I'm telling you that it works better the first 12 than the second 12. But before you guys make any medication change, I suggest that you speak with your physician, because I don't want them to say, well, Poetic said, and they're going to be like, well, who the hell is she?
No, I wouldn't say that.
Okay, but I would definitely
just say
check
the
with my
research
doctor.
I did.
I would definitely check with my doctor though, because it's a huge benefit of breaking up the long-term insulin, the long-lasting insulin, because it is going to work better those first 12 hours versus those second 12. And you have more of a steady blood sugar, because those first 12 hours you're being maintained, and then you'll start to fall off where your blood sugar starts to run higher, so it's not as effective. So definitely talk to your doctor, and most endocrinologists will agree with that.
Okay, well, I'll bring that up when again when my appointment come up, because this is the one thing I think that sucks with the health industry now today. It's so
The
many
health
people
industry,
that
I'm not making excuses for them, but the health industry is bombarded with sick patients right now. Not
yeah,
only
that's what I
because-
was going to say.
Yeah,
Yes,
they
I was
are.
going to
They're
say because of the health, they push your appointments way out, like 2 to 3 months, and you be like, "Do I really gotta wait that long?" But I understand that it's a lot of people that in each field or section of the health industry, is sick like that.
It is. And right now, to get into an endocrinologist or a kidney doctor, it is taking a lot of time. Unless you have an emergency situation, unless you are newly diagnosed and you were in ICU, then they'll work you in within a couple of weeks. But to actually get an appointment with one is taking months right now, because there's such an overwhelming amount of people that are losing kidney function. Since C19, we have an overwhelming amount of newly diabetics, newly patients diagnosed with hypertension as well as high cholesterol. It is so overwhelming right now. We just don't have room. We have 3 providers. We added another provider, and we're still booked out until sometime in May. It is extremely hard to get in. I do want to talk about being a patient advocate for people. If you have knowledge of diabetes, and if you have knowledge that can help someone else, because some people may not know the information, I would definitely try to be there with that person if they're in the hospital or if they're going to doctor's appointments, because not everyone has a patient advocate. And a lot of times these doctors are in a hurry. They will run in, they will run out. Another thing I notice nurses do. Nurses, if you're sleeping sometime, they will say they gave you a refuse of medication. Lie. You don't refuse a medication. They just didn't give it to you because you're sleeping and they don't want to wake you. You guys have to be your own patient advocate. And if there's somebody else that can be there for you to be your patient advocate, please allow that person to step in and be your patient advocate, because I don't think they always do right because of time, because of being overwhelmed, just because for many reasons. I mean, I'm not making excuses for people in the healthcare field, for many reasons. So you definitely have to always have a patient advocate. I'm going to come back to you. Slim, did you want to say something? You and then Hoover, and then I'll go down to Jackie.
No, I'm good.
Okay. Did you, Hoover?
I'm good.
Okay. Jackie, go ahead.
Okay, good afternoon, everyone. My
Good afternoon.
question is there a such thing being pre-diabetic versus being a diabetic? Because
Yes.
I'm still on metformin, so I was asking my doctor, if I'm a pre-diabetic, why am I on metformin? And last year in 2024, I ended up in the hospital because my blood pressure, and they don't give that medication while you're inpatient. So I was just thinking, if it's so bad to take in the hospital, why are we taking it at home? The metformin.
And it's not bad. It's just that metformin is the first line of defense. And pre-diabetic basically is dysmetabolic syndrome. It's basically your you are so close to being a diabetic. So if you don't modify with diet and exercise, or if they start you on metformin, then you turn into a diabetic, which puts you at risk for kidney failure, heart disease, neuropathy, vision problems. Vision problems is one of the biggest things with diabetics. They start to lose their vision. It starts to actually affect the retina over time. So that's why it's important to reverse those numbers. Neuropathy is another thing. Usually, not usually, but a lot of times what happens with neuropathy is a person loses their feeling in their legs. Sometimes they're walking barefoot and they get a cut or something. That decreased circulation, that wound doesn't heal. When that wound doesn't heal, they end up getting an amputation. So it's just a trickle down effect when it comes to diabetes. Now, an endocrinologist is going to be more aggressive with your treatment. Say you come in and your A1C is 6. Family doctor and internal med will start you off on metformin. That's just the first thing they do. However, endocrinologists, they're going to be more aggressive. They're going to say, okay, we're going to start you on Ozempic. We're going to start you on something to preserve your beta cell function, which is your pancreas. And then they want to actually prevent that liver from producing so much glucose. So endocrinology, especially our office, we're more proactive than we are reactive, where a lot of physicians are reactive. They wait till you actually have the symptoms or have the disorder before they start treating it. Then we'll treat it. Okay, your blood pressure's high, now we'll treat it. We're proactive. We want you to not get to that point. So we are proactive in getting the treatment ahead of time. Metformin is a good medication to start with. Metformin, in our opinion, in our office, is not always the best medication, because with metformin, like I said, it gets the insulin back into the cell. But if things don't change, if you come back in the office, you're still 6 and you're still 6.1, we have to add something else or replace it with something else to prevent your numbers from continuing to go up. If you go to the doctor 6 months later and your A1C is still 6, what has happened in the last 6 months? What have they done different in the last 6 months? What have they told you to do different in the last 6 months? You definitely want to make sure that A1C is constantly being reversed and it's not continuing to go up. So that is one thing I always tell my patients. Make sure your numbers are improving. If you're going to the doctor on a regular basis, if you're taking your medication on a regular basis, are your numbers improving? If they're not improving, why are they not improving? Is it because you're cheating on your diet? Always be honest with your doctors. Don't lie, because that's the worst thing you can do is say, yeah, I'm eating 3 times a day. Yeah, I'm not eating any sugar. We know. We know because of your symptoms, and we know because of the numbers. The numbers don't lie. So we can look at your numbers, and our numbers, we can look at the insulin levels, the C-peptide levels, homocysteine levels. Your numbers will tell us what you are actually doing. So it's important for you to actually tell us. If you drink, you let us know. Let us know how much alcohol you're drinking. I tell you, this is one trick the nurses and doctors learn. If you tell a person that you're drinking 1 drink or 2 drinks a day, we're going to multiply it by 2, because we know you're not telling us the truth. A lot of people don't tell the truth when it comes to that. If you tell us you're smoking a half a pack a day, you're smoking a pack a day. For some reason, they don't always tell the truth, and they don't tell all the supplements you're on. Some of these supplements can interfere with your medication. Always tell all the supplements you're on. Be completely honest. These people are not judging you. We could care less what you're doing. We just want to know what you're doing and how often you're doing it. So we're not judging you. We are there to actually help you get to where you need to be. Did I answer your question?
Yes, because I stay at, the last time I went, it was 6.5 and it's now down to 5 something. But I won't offer this metformin because I hear so many side effects about it. So it's kind of scary to me being on this metformin.
With you, all medications have side effects. If you look at the side effects that can come from a Tylenol, every single medication has side effects. That's why most people don't want to take medications, because of the side effects. And some of the side effects affects your lifestyle. That is true. So if you don't want to, you can seek out a holistic physician. Holistic physicians try to do more natural. Metformin has never hurt anyone, but I don't think that metformin is a long-term medication that's going to cure you either. If you've been on metformin for over a year and your numbers are still the same, what's the point of taking the metformin? I would talk to my doctor, say, hey, I've been on this for a year. Why am I still taking it? There's no improvement there. So I would definitely discuss that with the doctor. But you definitely need to look at all your medications, look at the medications and see if they interact with the other medications. Also, with other medications, when you go to another doctor, take the entire list. Don't leave out anything, not even a supplement, because if you're leaving out supplements, then you're not actually telling everything to the physician. You may be able to get off of the metformin, but then just make sure that you tell them, hey, I've been taking this, I've been eating right, I've been dieting, I've been doing this. Then they'll see what else they can do for you other than continue the metformin. But all medications have side effects.
Yes. Well, he told me because of my weight, but if you see me, I guess because I started off at 130, now I'm at 160. So he keeps saying if I lose the weight, I can probably get off all my medication.
That is a fact. If you can get your weight down, which Hoover can speak to this. Hoover has managed his weight with exercise, diet and exercise, and he has actually been able to not take any medications, because the first thing the doctor would do is put him on medications. He has not been on medications because of the diet and exercise. So that is extremely important. When a person has okay, so you look at a person when they come in the hospital to see if they're pear-shaped, or to the doctor's office, if they're pear-shaped or if they're apple-shaped. It's important. If they're pear-shaped, the fat and everything is around their organs, such as their heart, their lungs, their kidneys, their liver. So when you're pear-shaped, you're more at risk. If you're apple-shaped, so you have all the issues around your major organs. But if you're pear-shaped, you carry a lot of the weight in your thighs and your butt and your hips like I do. I'm not at risk. My A1C is 4.8. I'm at very low risk because I am pear-shaped. I'm 160 pounds, but my weight is in the bottom half of my body. So when they see you and they say, okay, more of your weight is around the middle, the more of the fat and stuff is around your major organs. So that is one way that as clinicians look at a person. Okay, well, we need to, if you come in and we're both 160 pounds, but your weight is around your organs and my weight is at the bottom, they'll treat you differently than as far as medication than they would treat me, because I don't have the weight around my organs. I'm smaller up top and heavier at the bottom. So that's why, you'll see when the physician looks at a person if they're pear-shaped or if they're apple-shaped. Does that make sense to you?
Yes, yes.
Okay, so are you apple-shaped or pear-shaped? And if you don't want to answer, you don't have to.
I'm a pear-shaped.
Okay, good, because you should be able to get off of the medication. So I definitely would talk to my doctor about it. You notice more men will have weight around the belly area, especially middle-aged men. They have more weight around the belly area, which, they have to be careful because it's going to affect their pancreas, their kidneys, liver and all that. So it's important. So a lot of times you see men, they have that belly fat there. They're more at risk because of the belly fat that they have.
Okay, well, I appreciate you answering my questions.
No problem.
All right. Have a good evening.
You as well.
Bye-bye.
May I ask one question before I
Yeah.
drop?
That baked apple shit.
May I ask one question before I go?
Yes.
I appreciate the live. I always enjoy them.
Thank you.
In your opinion, do you think a multivitamin is better than taking the single actual vitamins? Because I kind of differ, I'm stuck in the middle between that. I heard that it's better absorbed singly each vitamin that you want to take to make a multivitamin throughout the day, not all at one time, and then compared to just taking one single vitamin.
A multivitamin is excellent. Can you mute Charm, Boss Man, please? In my bio, under supplements, there's MitoCharge, which is like a super multivitamin. A multivitamin is excellent for you. And the multivitamin that is in my bio, it actually has lots of amino acids in it. It has thiamine in it, which I was looking at Slim's medication list. You guys, Slim had okayed me to look at his MyChart. So in there, they had put him on a multivitamin. A lot of times diabetics don't always absorb the nutrients that they do, and they really should be on a multivitamin. So in my bio, MitoCharge is an excellent multivitamin full of B vitamins, helps with neuropathy. There's also, it helps with hair, skin, nails. It also helps with energy. 2 tablets in the morning.
Can you hold that thought right quick?
Yes.
'Cause I really want people to hear this. All right. Yes, I've been rejecting some of the ladies' in requests because it's supposed to be Men's Health Live, So we're trying to get more men to come out of the shadows and share their health. So that's why I've been rejecting a lot of women's requests in the box. And then if I think you do got a question about a man in your family, I'll let you come up. But I'm going to start dropping y'all because Poetic always have women health lies and lies about women. Right now, she's trying to focus on the men because men do not talk about their health. So that's why I'm rejecting y'all. And some of y'all know this lie was going on, and some of y'all being inconsiderate. It's about men's health live. Okay, that's why I'm rejecting a lot of y'all requests. Go ahead, Poetic.
Okay. Now, Slim, you and Hoover took the mito charge. Now, did you think the mito charge, and honestly, Slim, I think the mito charge is what was helping you and not pass out before, because it was giving you vitamins and minerals and stuff that you were not consuming when you were not eating. Did you get any benefits from it?
From the mito, hell yeah. Mito charge actually probably was the only reason why I had energy most days, because I take that and that shit like an X pill, you know what I'm saying?
So that was like a pill?
Yeah, it's 2 pills.
Do you take 2 in the morning? I was taking 2 in the morning and 2 at lunch.
Yeah, lunchtime.
I'll take it at night.
That was something the doctors prescribed, or it was like over
Poetic.
Poetic.
Yeah, it's in my bio, so code, and it's called Mito Charge. But it's in my bio, and I'll text you about it. But it actually does help. It helps with your energy, especially if you're a driver. A boss man can tell you as well, and Doc will tell you as well. It definitely does help. You take 2 at 8 and you can take 2 at 12. I wouldn't take it past 12 because then you have too much energy. But it actually does, and it helps replace the nutrients, the vitamins, and the amino acids that you are actually losing. When you're a diabetic, you do lose a lot of that. Just here. Hey, what's up, fireman?
I need a new bottle. I'm just saying, you know.
There, buddy.
I got you, Hoover. I do. I got you. I'll take care of that. I will. Because I know sometimes I'll be mean to Hoover. Hoover, like, I'm going to cuss your ass out. Seriously.
Well, I just want to thank everybody on the panel for sharing that.
Thank you, Arthur.
Because I'm definitely going to check out your bio, because that's one of the things I've been complaining about. Energy with all 3 symptoms that I'm going through. With,
it
like
helps
I said, the
focus.
cancer.
It definitely helps your mind focus as well.
Yeah.
Yeah.
So I really appreciate it. I'm going to go back down and let other people come up. I appreciate y'all.
Thank you
And
for coming
Hoover,
up.
come on back around, brother. Come on back around. We miss you out here.
I'm trying to stay out of trouble.
I feel you, bro. But it's good to hear your voice, and I'm glad that you and Slim are doing well and stuff like that, and, you know, really trying to make the change to get y'all lives better.
Likewise.
Stay focused.
It's been a journey. I'm going to say that.
Yes, sir.
The journey has just
your
begun.
history, nobody else.
What'd you say, Slim?
The journey has just begun, goddamn.
Yeah.
Oh, well, my journey started, like I said, way back in 98. And I just, you know, I tell my testimony to whoever want to listen. I try to encourage. I do like Poetic say, you know, I inform people when it comes to a lot of stuff in the field, because I've been in and out the hospital. Y'all wouldn't believe it if I told y'all how much I've been in and out and been to doctors and seen doctors and, you know, all of this other stuff. So, but I'm still standing. I have all my limbs. I have all my senses and stuff like that. So I'm thankful for God to that. So, but I'm going to let somebody else come up and I'll go down and listen. Thank you again.
Thank you for always being here too, Arthur. I appreciate you.
Yes, ma'am.
Was next.
Hey, everybody, what's going on?
What's up?
I know that you might have been focused with on men's health. I wasn't sure if we were talking about anything specifically like diabetes or anything, or
Men's health in general, but